Good morning and good afternoon, everyone. My name is Rudy Inaba. I'm the Global Director of Nutrition and Exercise for Cenegenics, and I want to thank you for joining us today as we review how various physiologic factors can influence our sexual health, specifically our libido and erectile function. So let's just get into it. Libido is actually defined as our individual sexual desire, which is also unique because there is no set standard for a population. There's a variety among each individual. It is estimated that 1 in 5 men experience low sex drive, and this is a challenging statistic to follow due to a large number of men and women underreporting it to their physician, as it's commonly just viewed as maybe they're going through something emotionally, or it's just they're expecting to have less of a sexual desire as they get older. Erectile dysfunction is actually defined as the inability to achieve and maintain an erection for sexual activity. This is actually the most commonly reported sexual health issue by men, and it impacts more than 12 million men in the United States. So looking at some of the data of libido and erectile dysfunction, there was a National Health and Social Life survey that was published in JAMA that was a probability sample study of sexual behavior in both men and women. Men and women were in the age range of 18 to 59 years old, and the findings from the sample study looked at sexual dysfunction in 43% of women within that age range. 31% of men had sexual dysfunction in that 18 to 59-year-old age range. And they found that poor physical health as well as emotional health correlated to the sexual dysfunction. Additionally, there is a very well-known study called the Massachusetts Male Aging Study that was published in the Journal of Urology that looked at a random sample and it observed them for 2 years. And this was a group of 40 to 70-year-old men. From the findings, we looked at 52% of men were affected by erectile dysfunction, and that can be classified as either minimal, moderate, or severe ED. 40% of the men were affected by the 40-year age range when they first started the observational study. And by 70 years of age, 70% of the men were affected by erectile dysfunction. So the question for today is, are these physical changes simply age-related changes in my sexual health, or there is something that can be done about it? So let's look into some of the causes of low libido as well as erectile dysfunction. There are numerous physical factors that can be stress-related, medical conditions, medications someone could be taking. The emotional side of things would be anxiety and depression, substance abuse, whether it be drugs or alcohol, hormonal changes as we get older or even in youth, in our younger adult years, fatigue, chronic fatigue, elevated cortisol levels, more emotional things like relationship issues. Someone who has potential underactive thyroid could experience low libido, type 2 diabetes, cardiovascular health. These are all symptoms and these are all causes of low libido. When we take a look at our causes of erectile dysfunction, they are very similar. We have stress, smoking, excessive alcohol, overweight and obesity, same thing with anxiety, depression, substance abuse, type 2 diabetes, cardiovascular health. So there's a lot of similarities between potential root causes of changes in libido and erectile dysfunction and how they correlate with each other. So for today, we're going to look at 5 major components that Cenegenics views with our patients and that you can view as well on how to optimize your libido and as well potentially improve erectile dysfunction as we get older. Those things we're going to look at today are hormone optimization, our fitness or exercise, nutrition, nutraceuticals, and also stress management, as those are the ones that we can control more objectively. So with hormone optimization, a lot of times we're really going to focus in on testosterone. And testosterone has a significant influence on libido and also erectile dysfunction, as well as many other things that we'll look at. We do recognize that there is commonly an age-related decline in testosterone levels, being total and free testosterone, potentially as well as DHT levels, which is a strong androgen sex hormone. This is suspected to affect 1 in 3 men over 45 years old, and we do start to see that significant reduction annually, not significant, but a small reduction annually year over year with men as we get older with a decline in testosterone. Historically, that's associated with increased markers for fatigue, noticeable fat gain over the years, noticeable muscle loss, decreased libido, and also erectile dysfunction as our testosterone levels get lower. As a sidebar comment, it is also discussed and in conversation of, is this change in testosterone the main cause of these fatigue and fat gain and muscle loss symptoms, or is it a lack of nutrition, exercise, and all these things to maintain our health as we get older that is actually causing our testosterone levels to go down more rapidly? So that's a whole other discussion for another webinar potentially, but just something to keep in mind. So looking at testosterone and how it affects our sexual health, we reviewed about 17 studies that contained 650 total participants. And for patients that had, or the subjects that had testosterone levels less than 350 nanograms per deciliter, which is on the very low end of acceptable ranges, they actually had an increase in libido, erectile dysfunction, symptomology was improved. They did have an increase in morning erections, total erections during the day, and overall erection quality. And they also had an increased sexual motivation. So going back to some of the numbers there for those studies, so the baseline numbers that were used for low testosterone levels were around that 250 nanogram per deciliter. So these are patients that had less than 350, which is fairly common. And the upper range of total testosterone was considered 1100 nanograms per deciliter. So obviously going from someone who's below 350 upwards to even 700, 800, 900, or even the 1100 nanogram per deciliter can provide a significant improvement in their sexual function. Free testosterone levels were classified as a 35 to a 224, which were normal ranges. So again, going from that bottom end range to that higher end range, we yielded significant responses. During the course of these studies, the participants also had management of additional sex hormones, which is very beneficial, specifically dihydrotestosterone, which is what I mentioned being DHT. It is a strong androgen that has components of libido, strength, potential aggression if those levels get too high. But DHT is a sex hormone similar to free testosterone. And estradiol is another hormone as well that is monitored during the course of these studies. So as we look at those 17 studies and more, and from what we see anecdotally from patients, testosterone largely influences the men and women in the sexual domain. But it can also impact many other components of our health. We can have a response in carbohydrate metabolism, lipid profile, inflammatory markers, kidney and liver function can be adjusted, and also prostate health can be affected. So because of this, strict monitoring and frequent monitoring of patient programs where we look at all these different systems when someone starts a bioidentical hormone program frequently. So at a 6 to 8 weeks, initiating a Cenegenics program, quarterly, ongoing after that, to make sure all of our levels are in optimal ranges. If someone is on a bioidentical hormone testosterone program, they are not receiving frequent labs, they are not receiving comprehensive labs that look at all of these different things, it could be a potential danger to one and their health due to the influence that testosterone can have on all these other things. So another note that everyone should make is that poor erectile health is a potential warning sign of heart disease and or other circulatory problems. So because it's a potential risk factor for heart disease, how else can we improve our heart health? If erectile dysfunction is a symptom of developing heart disease, well, how can we not develop heart disease and prevent that from occurring? So obviously the first thing we're going to look at is exercise. So there are significant physiologic changes that are related to increasing our fitness levels, whether it be cardiovascular health, muscular strength, and muscular flexibility. And that's going to be related to reducing our inflammation or our total body inflammation, commonly measured by our C-reactive protein levels that we discussed in my previous presentation on biomarkers. Improved insulin metabolism. So if we have poor insulin sensitivity or we're insulin resistant, we have very poor insulin metabolism. We're not utilizing our carbohydrates very well. We're not responding with insulin very well. And that can lead us to increase fat storage and also be more inflamed in our body. We can improve lipid profile with exercise, doing high intensity interval training as we mentioned in another previous presentation, we can actually increase HDL, which is our good cholesterol. And that's going to be very beneficial to our health and by managing our lipid profile for our cardiovascular function and also our vascular function. And just general increased cardiovascular health. If you're doing cardiovascular exercise and your heart is being better at delivering oxygen to working tissues via the blood, you're going to be overall just significantly healthier. So optimized cardiovascular function can improve erectile quality. And that can be caused by the improvements, as I mentioned, in arterial health and how well we can supply oxygenated blood to the tissue. Because reduced blood flow to the tissue in someone with erectile dysfunction may be caused by arterial plaque built up, but also microplaque built up in the tissue. And commonly when we talk about heart health, we talk about arterial plaque at the carotid artery, but we can also see microplaque that's found in the vascular systems of the penis. So if we can improve our health there and we can break up that microplaque and improve our vascular health, we can then potentially improve our erectile dysfunction and symptomology. Right alongside exercise is nutrition. This has a significant impact on a number of physiologic factors, just like exercise does, and just like in the same components. We have inflammation components, insulin sensitivity, our lipid profile, as we mentioned. But another one that nutrition can provide is micronutrient-mediated functions. If we are eating poor food choices or low-quality food that are not rich in micronutrients and vitamins, we can then become deficient in a number of things that can then significantly impact how our body functions from day to day. If our levels of zinc are too low, we can start to see reductions in testosterone levels. We can start to see changes in our mood and potentially increased symptoms of depression. Same goes for essential fatty acids or omega-3s. So the EPA and DHA omega-3s can actually have a significant impact on our mood and how well we're able to recover from exercise and be motivated to exercise. So if we're missing out on a lot of these positive foods that are providing a lot of these nutrients to our health, a lot of systems can start to deteriorate. Again, low libido affects people with diabetes, type 2 diabetes, more so than those without. So by improving insulin sensitivity and by reducing our risk factors for type 2 diabetes, we can see a potential improvement in libido just by managing that, by managing our carbohydrate consumption. Low libido is also reported heavily by people with heart disease. So really there's a lot of correlations. It may not be direct cause and effect. However, these correlations are very strong within the populations. And the risk factors associated with heart disease and type 2 diabetes, we can have a large amount of control over. So nutrition overall provides very indirect positive influence on our sexual desire or our libido and erectile function via fat loss. In one of the studies, I believe it was the Massachusetts one I mentioned earlier, nutrition was looked at, and they looked at the individuals, and the ones that had diets that were rich in foods like fruit, vegetables, fish and other seafood, managed the amount of red meat they had. They didn't not eat red meat, but they just ate red meat, on occasion. And they had very low amounts of processed meats and low amounts of refined carbohydrates. They actually had significantly less of a frequency of erectile dysfunction and self-reported poor libido. So they were reporting that their sexual function and sexual desire was much better than those that were not eating these foods. So really, in summation on that, weight loss, more specifically fat loss, can improve libido and erectile function. When we say weight loss, that can be, our lean tissue, which is our muscle mass, but also our fat mass. So more specifically speaking, fat loss can not only improve our energy levels and our insulin sensitivity and our cardiovascular risk factors, but can also improve our libido and erectile function because it's allowing our body to have better management of all of our symptoms. So some data behind that. It was reported that men with a waist circumference, like a belt size, larger than 42 inches, were actually 50% more likely to experience erectile dysfunction than men with less than a 32-inch waist. So that's associated with abdominal adiposity, so central body fat, visceral fat that's around the organs. That's very inflammatory fat. It's associated with heart disease, metabolic syndrome, type 2 diabetes, and also some cancer development. So again, that correlates with everything that we're talking about as well. Additionally, men who exercise more than 3 hours per week had a 30% lower risk factor for erectile dysfunction. Now, we didn't get to see exactly what they were doing within that exercise, but generally just the effort involved with going to the gym 3 1-hour sessions per week or 30 minutes, 6 days a week is typically associated with someone trying to live a healthier lifestyle and seeing that fat loss. So that does make sense that they would see that lower risk factor for erectile dysfunction. Stress management is another one. We talked about this when we looked at biomarkers on our last webinar regarding cortisol levels. And looking into stress, acute stress is considered normal. Small amounts of stress from day-to-day basis are even healthy in a way. It allows us to, cope and problem solve and do a lot of good things that we should be able to do. But chronic stress that builds and builds and builds over time can have a large impact on our physical health. That can disrupt our healthy cortisol levels. That can disrupt a healthy hormone production. And that can also disrupt a healthy sexual desire. If we have chronic stress, that's going to now have our adrenal function kind of pushed to the max. So cortisol levels will start to rise very high and then potentially drop as they would deplete. That can impact our testosterone production. That can impact our free testosterone markers. And those things combined can also affect our libido or our sexual desire. So for stress management techniques, there's a lot of things that we've talked about in the past, like meditation, but optimizing sleep hygiene to increase our sleep quality and duration is very positive. Nutraceuticals we'll get into that are going to help with anxiety, depression, and also stress management. They'll give a big boost of cognitive function and energy production in the patient. So nutraceuticals. Nutraceuticals is another one. It is one of our pillars for optimizing our patient's health when it's clinically indicated. What we're going to go over today are primarily natural adaptogens or adaptogenic herbs or roots, as well as certain micronutrients, because they can indirectly support a healthy sexual desire or an optimal libido. Some that come to mind through the data and also through suggestions I've made are maca root, ashwagandha, long jack root, cordyceps, zinc, lycopene, and omega-3 fatty acids, being our EPA and our DHA. So just for some insight, because some of these may be new to everyone, but maca root is actually a Peruvian plant. It's a root, but it's grown in Peru. And research, like actual clinical data, suggests a notable increase in libido or sexual desire and may have an inherent ability to help those with erectile dysfunction. They studied maca root in a number of different doses, ranging from 1.5 grams to 3 grams, to even 10 grams per day to increase libido, and it all showed positive responses. I believe the 10-gram dose was studied in a specific group that had they were on SSRI medication. So they actually had SSRI-induced sexual dysfunction. So while they were still on that medication that was actually the root cause of their sexual dysfunction, the maca root was actually able to help them improve their libido. It's also been shown to reduce anxiety and depression in postmenopausal women and is anecdotally reported in male users as well. Ashwagandha has been very popular for a very long time. It's an Ayurvedic root. You're actually now seeing ashwagandha in a lot of new sports nutrition products because research shows that it has a notable anti-anxiety effect and cortisol reducing properties. So really, if we have elevated cortisol and elevated anxiety, that can then start to really push our adrenal function to the max. And as our adrenal function gets pushed to the max, we experience these things like fatigue, like depression, like stress. And then the next step we'd also see is the reduction in our testosterone production. So really, ashwagandha is cool because we're actually able to see that, okay, it has cortisol reducing properties, which we see a shown decrease in anxiety, decrease in depression and stress. And then we see a positive response in testosterone, sperm quality and motility, and exercise performance. So really it shows that, when someone says there are anti-anxiety effects, it triggers this kind of cascade effect of if we can improve our stress response and have healthy adrenal function, we can then start to have better hormone production as we get older. And that's going to yield better testosterone production, sperm health, libido, erectile function, and even exercise performance. Long jackroot is another one. Long jackroot is a Malaysian herb, and it was actually studied and suggests as directly a pro-erectile agent. It increases sperm production, and it also delays the time of ejaculation in those that were studied. So again, studies show that this has been able to decrease our perceived stress and cortisol response. So decrease our perceived stress and also decrease our cortisol response. And it's been shown to increase our libido, erectile health, and also subjective well-being. So again, these adaptogens, they function in a way where we can manage our adrenal function better to improve hormone production, which is then going to improve libido and erectile function. Zinc is another one. We're able to actually see our patients' zinc levels when they do their micronutrient testing. And it's really interesting to see because a lot of times patients aren't eating enough foods or high quality foods that have zinc that can carry over into their cellular health. So they may need to supplement with it. And zinc deficiency can be a direct result, it can directly result in hypogonadism, which is low testosterone levels. So we need zinc in order to have good testosterone production. Insulin resistance or type 2 diabetes or poor insulin metabolism or poor carbohydrate metabolism, anything related to not being able to really manage carbohydrates very well in our diet due to obesity can actually decrease our zinc levels. So it's this cascade effect, like I mentioned earlier, where if we live very poorly and we build up a lot of body fat, we can then start to have poor carbohydrate metabolism, which can lead to insulin resistance. That can then decrease our zinc levels due to that. And then the decreased zinc level can then cause lower testosterone. And then that lower testosterone level can then cause issues with libido and sexual health. So it's important to maintain these foundational components that Cenegenics has our patients do as a core value, because by doing that, we're able to really maintain or really control the root cause of these issues as we get older. Zinc has also been shown to increase testosterone, IGF-1, and DHT. It's also been shown to decrease fasting insulin levels, LDL, so our bad cholesterol, and also markers for depression. On the same depression side, omega-3 fatty acids, so fish oils or other foods that have EPA and DHA can not only reduce our triglycerides, but they've also been shown to have a significant improvement in mood in the participants that actually expressed major depression due to reducing neuroinflammation, among other things. So omega-3 fatty acids are a really important thing to incorporate. One thing I always need to kind of throw in, again, as a sidebar comment, is that fish oils, if you're taking fish oils for omega-3, EPA, and DHA, they are not all created equal. Cenegenics and myself, we are fortunate enough to partner with our clinical manufacturers that we are able to provide very concentrated fish oil that has high amounts of EPA and DHA. For example, in maybe 1 gram of fish oil or in 1,000 milligrams of fish oil, over 800 milligrams are EPA and DHA. Over 800 milligrams are active components, so 80% or more. Whereas if you look at supplements that are lower cost that are available via retail, that 1,000 milligrams of fish oil may only yield like 300 to 400 milligrams of EPA and DHA. So you're only at 30 to 40% of concentration of active ingredients. So just something to keep in mind. But that same EPA and DHA has been shown to improve endothelial function, specifically blood vessel responsiveness. So our blood vessels should be able to flex and change and adapt to changes in blood flow and blood pressure. And omega-3 fatty acids have been shown to make them more responsive, so endothelial function is improved. And that's an important factor when someone has a good libido, but they are experiencing some sexual dysfunction from erectile dysfunction, because blood flow needs to get to that tissue. And if they have poor vascular function and poor blood vessel responsiveness, that can be a significant factor that can be leading to their erectile dysfunction. And lastly on the list, we have boron, which is, it sounds boring, but boron is actually really cool because it's been shown clinically to increase total and free testosterone in both genders. The notable increase in free testosterone, even in someone with a normal total testosterone, is likely due to possible changes in sex hormone binding globulin. So these are all things that we actually can look at in our micronutrient testing for our patients to see how aggressively we need to utilize our nutraceuticals along with bioidentical hormones. So, like I said before, these core principles executed repeatedly over time, paired with physician guidance and clinical guidance, can often provide the desired outcomes that we're looking for regarding libido and sexual health and erectile function. It is not 100% everything. It would be ignorant of me to say that there is not an emotional component tied to these risk factors. However, from a physiologic side, we manage a lot of these and we cover our grounds with these core principles. So to do that, to look at what our risk factors are, Cenegenics, we offer our Cenegenics Elite Health Evaluation, which is a 6 to 7 hour executive health evaluation where we collect baseline data on all of our patients prior to developing any kind of program. We're going to uncover any origins of issues and symptoms that someone is dealing with, whether it be libido, erectile dysfunction, cardiovascular health issues, type 2 diabetes, metabolic syndrome. We're going to uncover all of this through our significant tests that we're going to perform in office. And then we're going to analyze what the priorities are from an objective standpoint for the patient and how we can objectively treat that. And also from a subjective component, because medicine is really an art form. We can't just work on the numbers, we work on the patient. So by doing a combination of both, we're able to provide the high quality care that Cenegenics is known for over the past 2 decades. From there, we're going to develop an action plan that achieves optimal wellness for the patient. And optimal wellness can mean different things to different patients. Someone may be coming in from a sedentary lifestyle, 30 to 40% body fat, really poor exercise program. They're going to have the same motivated response from our team as someone who's coming in from a weekend warrior who just has, a few different items that maybe don't seem as important to the other person that's starting. Everyone has an important action plan. Everyone is going to execute that action plan, and we're going to hold them accountable to that. As we get better and as we grow and as we adapt and we start to improve our health, we're always going to adjust our program and pivot to a different priority to make sure that all of our bases are covered for patient health. So there's a quote that I saw that I liked that says, we don't stop playing because we grow old because we stop playing. So when we throw in the towel and we say we're just getting old, that's when all these symptoms exacerbate. That's when we start to recognize all these things a lot more. However, if we really live and want to live a youthful, vibrant life, getting our exercise in, getting our nutrition in, managing our stress levels, managing our hormones with a physician, and being able to do all these things that we love to do, we're going to be able to hold on to that youthful lifestyle that we want. There are a lot of positive, a lot of great aesthetic components that Cenegenics offers to our patients by reducing body fat and building muscle and, looking great and feeling great. But that internal side of things of really gaining back that vibrant youthfulness as we get older is really one of the most valuable things that I see in our patients. So I do ask that if anyone has any questions after this presentation, to please call the number on this slide. And if you have any questions for me directly, if you've been attending, my webinar series and you have any specific questions for me or are interested in actually a limited time pricing offer that I can offer to you directly, my line is right there, the 702-953-1536 to contact me directly. We're still recording live. So if you call me now, it'll go to my voicemail, but I'm happy to answer that later on. So again, Cenegenics, we like to say reclaim your glory days. And it's, it can be anything from an athletic standpoint, from an aesthetic standpoint, body composition standpoint, but really, regaining that vibrant health and that youthfulness to be able to, live well and live well longer are our number one goals. And we want to help you achieve that. And as an extra, by managing our social media, we do have a lot of questions that come in about testosterone, bioidentical testosterone replacement, and the safety components regarding prostate health. There's a lot of misinformation out there. So we've actually posted on cenegenics.com/blog, going into a educational series on prostate health. What is the prostate? What does testosterone replacement shown to do with prostate health? What are the risk factors associated with developing prostate cancer? Because a lot of the information out there and a lot of the info that's regurgitated from one Facebook account to an Instagram account to another, it's almost like a game of telephone. So we hope that we can answer a lot of your questions on the clinical side and have someone feel far more confident in their choice in making the efforts to call and to improve their health with testosterone therapy if clinically indicated. So with that, if we have any questions, I'm happy to take them right now. So the question I have, does sleeping 6 or less hours affect your overall testosterone? And that is absolutely true. I forget, I can't recall right now where the study was published, but they looked at sleep duration and changes in sleep duration in a very short window. I want to say maybe like 7 to 10 days. And for those that it was forced, sleep disruption. So they were waking people up at like 5 hours or letting them sleep 10 hours one night, and any kind of disruption. But for anyone who slept less than 6 hours per night, even within that 7 to 10 day period, they saw I want to say 15 to 30% reduction in testosterone. And that's just within those amount of days. So if someone is living a lifestyle where they're sleeping less than 6 hours per day for year over year, decade over decade even, that can have a significant impact on your testosterone production, as it's going to affect your recovery process. You know, if your body can't recover, that's going to put stress on your adrenal function. That's going to affect your testosterone production. Are there other options besides lifestyle change or pills that can help with erectile dysfunction? And there are. And Cenegenics is very proud to offer our shockwave therapy for some of our patients. So many of our patients do note significant changes in libido and erectile function just on the core components of our program. However, we do offer additional treatments in a number of our centers called shockwave therapy. And shockwave therapy is for our patients that do experience mild, moderate to even severe erectile dysfunction, where we utilize a tool from an ultrasound wand. And the ultrasound wand is actually done on the patient's penis. And it's around a 20 to 30 minute session. And what the ultrasound does, it actually sends acoustic waves into the tissue. And those acoustic waves can break up the microplaque in the capillary beds that fill up the corpus cavernosa and corpus spongiosum, the tissue that's in the penis. And we can break up the microplaque, which is actually going to allow for better blood flow, which is a main component of erectile dysfunction, but can also increase and stimulate growth factors that can then potentiate new vessels to grow, new small vessels to grow, so you can actually fill in even more blood than prior. So it's a very interesting thing. We offer it at a number of our centers. And for someone who is maybe experiencing, maybe they have very, very high interest in improving erectile function, more so than what we can just do through lifestyle and through testosterone management, if it's indicated, and they wanted to include this in their program, it's something that we can do. It's non-invasive. Like I mentioned, it's around a 30-minute session in office, and it can be beneficial for anyone that's experiencing very mild erectile dysfunction or even no erectile dysfunction. They just want to improve their health. But also for someone who does have severe erectile dysfunction, it is shown to be very beneficial. And in the worst case of scenarios, we can also incorporate different PRP methods with the shockwave therapy. Does Cenegenics provide a product that includes all of the nutraceuticals? The ones that we went over at this time, we don't have one that's made for erectile health and also for libido. However, we do have a natural testosterone formula. Now, for patients that are taking bioidentical hormones and testosterone, when it's indicated, it sounds like they may not, need the natural testosterone product. However, the natural product is a combination of 9 different adaptogenic herbs, very similar to the ones I mentioned. Maca root is in that, the long jack root is in that, and there's additional ones, and cordyceps that I didn't get into is also in there. And those adaptogens can also improve adrenal function, which can then also improve our libido that way as well. So while you may not be interested in taking natural testosterone formula as a patient to improve your testosterone production, it can yield other positive benefits that you may find in the realm of libido and erectile function. All right. So I want to thank everyone for joining today. And again, if you have any questions on our libido and how Cenegenics can improve sexual desire, how Cenegenics can improve erectile dysfunction, and also, as I briefly mentioned, how testosterone is not a significant risk factor to prostate health, as I mentioned. Feel free to go to our blog at cenegenics.com/blog, find those articles. We have all our references listed, so you can see that all the data is coming from with clinical significance. And if you have any questions outside of this webinar for myself, you can find me at 702-953-1536, and we can discuss a potential limited time offer for a Cenegenics Elite Health Evaluation. And you're also welcome to call our team at 866-240-0035. Again, I hope you enjoy these webinars and these educational series. If you have any suggestions of what you'd like to cover in the next, please feel free to contact me and let me know. Thank you.